Hi, my name is Beth Bolden, and this is the Introduction to Professional Nursing, INL 215, and today I'm going to demonstrate on how to access peripheral pulse by palpation. So first thing that I'll do, I'll check on the client's records to see if there's any nursing plan for frequency of pulse assessment. Once I'm done with that, I'll see if I need any PPE, which in this case I do not need any PPE. So I'll proceed and go to patient's room. I'll knock, introduce myself, provide privacy, and do some hand hygiene. Make sure my hands are dry. Once I do that, I'll assess the patient for ability of assisting with the assessment, which my patient can assist with anything. So I don't need any gloves, so I'll go ahead and select the appropriate peripheral site based on the assessment data, what I see, like whichever hand she preferred to do her pulse or whichever hand does not give abnormal reading. And for this purpose, I'm gonna use this as my patient's hand. So I'll proceed. If there are any clothes covering the side that I want to use, I'll make sure I clear off the cloth or I push it up on her hand. Or if she needs to take it out, I'll request the patient to take it out so that the part that I want can be exposed. So once I do that, I'll use my three fingers, my index finger, my middle finger, and my forefinger, to palpate the site and just to get the peripheral reading. So I'll proceed. First, I'll help by using my other hand just to help and get the right position on how I can take the reading. So sorry, I'll go ahead, hold, and palpate for the pulse. Once I get the pulse, I'll make sure I hold it with my first, second, and third fingers over the artery by making sure that the ends of my fingers are flat against the patient's skin and palpating the peripheral pulse. So once I get it, yes, I found it. I can hear, I can feel it. So I'll slightly press the arteries for palpation. So I felt it, and then I'll continue counting for 30 seconds using my second hand watch. So for 30 seconds, and if the reading is abnormal, if I'm not getting the correct reading, I'll proceed and count it for 1 minute. If I count it for 30 seconds, I'll have to multiply it by 2. If I count it for 1 minute, I'll just get the reading as like that and proceed and record it. So I'll reposition my client in a good position, and then I'll proceed and do my hand hygiene. And go ahead and record my reading.